Good afternoon. This is Dr. Bill Wyatt, and I want to talk to you a little bit more about kind of the mysteries of a deep bite case that unless you have done a good bit of orthodontics, you won't run into some of these problems doing the just simple young people's deep bites. So let's get on with this, and I'm going to show you case number one. Is a gentleman, and you see when he closes his teeth together, his chin is a little close to the nose right here, and so you really want to open his bite or bring the chin down, something like this. And so you can do this orthodontically by putting a bite plate between the anterior teeth up here to open this up a little bit, and the back teeth will erupt together, and that whatever they go together, that will increase this length here. So let's see what this does. Now this gentleman is really a very smart man. He was operating the computers for American Airlines that do the tickets for all over the place where American Airlines is working, and even other airlines had them work on them. So it was a headache, tough job that he had. And so his temporomandibular joint was just giving him a fit, and he was having to take medication because of that, and he could hardly hold the job. So he came in. I don't know how he got word we had done cases kind of like that. And anyway, he comes in, and let me show you what we did. Okay, he's got a deep bite, it's obviously, and we started in 3/11 of 93, and the bite is extremely deep there, and he can't move his jaw forward because the upper teeth are down over it, and so he can't come out like that, and he needs to do that. And he's got crowding in the lower anterior teeth in addition. Excuse me. Now he's nearly class 1. See, if this corner right here were out something like this, come up in and come out here, and that would, if we could move the jaw forward that much, he would be in a class 1 relation. At least these teeth would. Now it wouldn't be out here in front until you open and get that in place. Now if you're just starting out, you think, well, I'm going to have to extract that tooth right there, but you don't really. Go ahead and open the bite, and it'll change the position of those teeth. And so you can put a bite, you can put one of these where you pull the arch wire down. That's an intruding arch wire. I don't think we use that exactly. Now this side over here is really quite class 2, and you're going to need to move this red dot back to where this blue dot is, right here. Now that's just the way I have of showing you where we're going to go to the class 1 relation. And you can see his lower jaw can't move forward. It's locked by the deep bite out here in front. Now he's actually worn a hole in the crown that he had on this tooth right here, with his jaw trying to move forward, but it couldn't get there, so it was causing the lower jaw was pushing back, and the head of the condyle is back there on the retrodiscal tissue, and it gets inflamed, and the further you push back on it, the more it hurts. And you can feel it yourself. You don't have to have somebody to feel the joint like that. And this upper jaw, and let me show you how the lower jaw looks now. It's squeezed all up. You see, these teeth are out toward the tongue this way. And these teeth are right up against the back teeth. And he ground them off. I mean, just there were some crowns on the upper teeth, and they had this porcelain backing to the crowns. And porcelain is like a fine grindstone. It will wear the teeth down if it's coming up against the teeth like that. So to see the spot worn in that cuspid and round it like that, and you'll see that on some of the other teeth. And you look, why does that happen? Well, that's it. All right. Now, let's go on to the second picture. Now, I'm jumped way over, and if you want to follow this a little closer and see it in detail, just go to this video. We have a whole video on him. It's most interesting. Now, he was having terrific pain in the temporomandibular joint, and we opened the bite, and the jaw was free to come forward, and we had plenty of room to expand it. And if you look at how it was, it started in 11 of 93, and when this is January the 21st of 90, I don't know what is it, 93, no, it's 98, so that didn't make any sense there. So here he's going to move the lower jaw forward and open the upper jaw, and we got room enough to bring those teeth into that position. We just expanded the arch and brought them in. Now this is where this cuspid should be in a class 1 relation, and we got a little space in between here, and we worked with it like that. So I had to keep that cuspid in that position. Now, the gentleman was hurting so bad with this till he couldn't hardly start the job. He couldn't stay on it. Now, when we got it bite open and shifted the jaw forward, even though he was under a lot of stress, that took care of it. He stopped having the problem. And so I wanted to bring out, when we got him out here, he doesn't have any pain, even though he kept the job and kept doing this stressful stuff. I thought at first when I talked with him that he was just loaded with all the stress and this was driving the pain, but it wasn't. We just moved the jaw forward. And let me go back and see where it is right there. Now we moved the jaw forward and opened the bite and freed it up where the jaw was free to move forward, and the pain went away. And that's remarkable that you can do something like that for a person. And so I want you to know that you can do these things. Now, if you want this in detail, you can go and find the video on him. Then he had some more crowns put on the upper, and the lower that were whirling down so bad, he had them crowned too. Now we had it fixed where the porcelain would be rubbing, or there was no porcelain rubbing on these teeth. Let's look up here, and well, I didn't put that on there, but if you go to the video on this gentleman, and it will show you in detail what we did here. Now here's case number 2, and I want to rush through this. This is a gentleman that came in from down in Goldthwaite. That's another town about 60 miles from where their office was, and he was having really bad pain with his joint, and his his bite can be opened, you see, where he was. And let's look at this. This is 4/19 of 2000, and you can't even see his bottom teeth. And this was before we started using gloves too. Now here is the bite. I mean, the lower teeth are about 4 millimeters higher than the upper teeth. And then the upper front teeth are down lower than that. And so there it is with the teeth pulled in like that. And that held this guy's jaw forward. He had had some orthodontics apparently, and somebody extracted these teeth in here. And that wasn't the cause. It was this up here is forcing this jaw back when it comes in contact with that. So we did the same thing here. Now the lower is really crowded and all the teeth are in there on the lower. Now what we'll do here, we're going to open this up. Now here's another facial picture, and this is 03 after we had finished, and this is the position we brought these teeth to, right here. I'm sorry, that one is upside down. There we go. We got excited here and got them in the wrong position. Now, the upper jaw is it's missing those teeth. The upper had a bite plate in it, and we stopped right there, and the lower we put a bonded 3x3 on it, and we kept his jaw in that position as one tooth up above gone, and the lower sliding down on the bottom. Anyway, his pain went away when we opened the bite and let it slide forward. And he was a real nice fellow. He had a farm down in Goldthwaite somewhere, and he would bring watermelons to us every time he came in. So that's the way that case ended up. And here's another terrible dental problem here that this young man, see that cuspid on the right side sticking out and rubbing against the lip, and he had a crooked set of teeth. I tell you, it was just, I've never seen any worse teeth than that, and you probably would not want to try one of these unless you just really have learned how to deal with it. Now we're going to put something in here and block this bite here somewhere and get these teeth to move toward one another in here. Let's see how that works out. And there it is from this standpoint, and we put a spring over here and a spring in here to open this, and this is a little flexible wire. This is a little night node, and we'll come off, and here already is one intruding arch wire. You see it comes out of the molar and goes around like that and comes over here, but then you run it down low like that, and we brought it up and hooked that. Now that's really not the way this wire went. It was formed this way. We go down and come around, and now we take this down. Now when I move this up, that tightens that spring. So I'm sorry I got you off there on that. It's hard to see that exactly. Now that's going to bring these teeth down, and we've got another where we're expanding this, and as I push them forward, they'll get out of the way, and we'll have to get. This is a long time ago when we did this case. This is 1976, and I just started nothing but orthodontics in 1970. But anyway, let's watch what happens in here. So we've got forces pulling this down and a little bit of force bringing this one up, but not all that much. Now, looking at it from the front, we have a tooth out over here, and whether we took that, and this will move this cuspid back, bring this laterally in, that'll slide this over, and we bring that, we'll bring these back in this area too. So we'll have to go through it, and gradually that began to work out, and it finally leveled this guy's bite, and this is kind of the way we finished it. And that's back when we had all these bands, so we had to close the band space to do that. Now, if you'd like to watch this in detail, you can go to this video and it'll show you in detail everything. But what I wanted to bring out was these deep bites cause more trouble than people think. You cannot chew with a deep bite. You just have to bite like this, and really chewing is much more efficient if you kind of grind stuff back and forth like that. It's much more efficient. Now here is his lower arch after we got it lined up, and there's a tooth out in there, and so we finished the case like that. And here's another case number 4. And this gentleman right here is a real nice fellow and has this beard. And he has a deep bite like that. And so we're going to put this wire over like that and pull this up. And we can be doing that while we've got a little flexible wire on the teeth. And this will close it while we're straightening this out down here on the bottom. And you can put all this on the first day you work on the person. And here we've got no teeth back in the back of the mouth, and that makes it very difficult to open. You don't have anything to work off of down on the lower arch, and you see this arch, the palate is kind of rotated like that. And in other words, it ought to go straight up this way. So we tried to enlarge this side over here and pull this back with some crossbite elastics and stuff of that nature. Now he had no teeth on the back here, so that made a problem, and we had to put something to kind of hold that together. So we had a partial made in here. He had some teeth on it, and this was made when we started, and we kind of worked with that in there. But if we look at it from the back side, the teeth went up almost to the tissue behind the teeth. And we put these intruding wires on, and we're going to, as we get these up, we're going to move this bottom tooth up to here, and this will come back to there and put those dots over one another. In other words, that gets him to class 1. And while you're doing it, you're working off of this tooth, and don't let it lean over too far. And the other side of the mouth was much more difficult to do. We got there, we had nothing behind to work with except that partial, working off of that. And we got the bite open, and this just moved up where we got this over that dot there over it and got it to a class 1 relationship. So go and look at this case, and you can see in more detail. Here was the x-ray we got when we started. This tooth was leaning way over to get it in there. and these were totally gone.